Join Black Westchester publisher Damon K. Jones for Wellness Wednesdays, your weekly guide to holistic health and spiritual well.
That's how I
Right.
take it. That's where
Right.
I stand. And I feel
Well,
bad.
we're gonna go into some of these. Because see, here's another thing. A lot of people, and I understand, people are busy, and they get snippets from the news and they hear with the news, and they don't have ample time to actually watch certain things. This is RFK having the discussion about vaccines, that black children should be on a different vaccine schedule than white children. And this is, and there's been holistic doctors like Dr. Africa that I'll talk about it after.
You were on a show on February 26, 2021, an interview with Dr. Judy Mikovits, where you said the following, and I quote, "We should not be giving black people the same vaccine schedule that's given to whites because their immune system is better than ours." Can you please explain what you meant?
There's a series of studies, I think most of them by Poland, that show that to particular antigens that blacks have a much stronger reaction. There's differences in reaction to different products by different races.
So I have 17 seconds left. Let me just ask you then. So what different vaccine schedule would you say I should have received? What different vaccine schedule should I have received?
I mean, the Poland article suggests that blacks need fewer antigens than.
This is so dangerous.
You get the same measles vaccine.
Mr. Kennedy, with all due respect, that is so dangerous. Your voice would be a voice that parents would listen to. That is so dangerous. I will be voting against your nomination because your views are dangerous to our state and to our country.
I mean, do you think science is dangerous, Senator?
Here's the deal. For a black woman to sit here and say this man is dangerous.
She didn't even let him finish.
Right, she didn't let him finish.
Or talk about the studies. It was just kind of like, well, no. I got 17 seconds. I got to make my point.
Exactly, brother. Like, because it's like, wait a minute. He's trying to quote studies, and you want to dismiss studies, but you don't even have to go far as the studies. You could go to Dr. Layla Africa's book on melanin, Why Black People Are Black. And he talks about how melanin in black people, we process things differently because of our melanin. He didn't say anything different than what Dr. Layla Africa was saying.
Here's what I would say with regards to these congressional hearings. First and foremost, there doesn't seem to be enough time. It's more so like when someone is trying to get confirmed, it seems to me that the opposing party is trying to take shots more so than trying to learn why their position is different than what you typically know, right? And that sort of setup prevents any new ideas from coming in, or even better ideas, because if you come in with a better idea potentially, you're seen as sort of like a heretic, right? You're seen as sort of like out there. Whereas if you had a setup where, okay, put your positions, if they had RFK, these are the things we want to talk to you about. We want you to provide scientific evidence for why you made this statement or why.
Right.
And we will study this. We will have our own advisors who are in the medical profession, scientists, that sort of thing, review why it is, and then they can give us a rebuttal to those positions. Does that make sense? Now you have more of an intellectual conversation rather than an emotional conversation, because that was, she asked a question, he cited a study, okay, which I guarantee you she doesn't know anything about that study. Whether the study is strong or weak or good or bad, she knows nothing about the study. But her response is emotionally charged. Okay. And so it's all about gotcha. You're dangerous. You're this, you're that. And again, this isn't just with RFK. This is for anybody.
Right.
Okay. It would be better if you had asked them before these sessions, what are your positions with regards to these things and why do you take them? And then have your team review them. And if a study is bad, fine, call them out on it. Hey, our team of experts said this study was actually biased. It was actually bad. It was poorly conducted. Therefore, it has no merit. So we'd like you to take that statement back. Then you're looking at a more logical, right? A more logical congressional hearing because now you've taken the emotional out of it. But that little outburst, I guarantee you, the only people that supported her are, let's say, Democrats. And the people so it forces people to take an ideological stand and say, well, I support her because she's a Democrat, even though she had no facts, no logical position, just an emotional outburst. To me, it's ridiculous. But again, the setup forces this sort of interaction. And that's how I look at things.
Well, you know, exactly. But then I don't know how she tries to play the race card when the study says that we are stronger. You know, it's like wait a minute. The study said that the black race was the
The
stronger race.
Yeah.
So how do you play the race card and say is like he's dangerous to black people, to black mothers, to people like her, like she said, like me, right? When the study said, no, you're the stronger race in your genetics, which we know.
Your immune system, yeah.
Exactly, which we know, right? And you know, we got caught up in COVID because of our chronic illnesses.
Yeah. That was and that's another thing, right? If you look at, oh boy, even just going back to COVID, right? All of the nonsense that took place where I forget the exact number, but the probability was extremely high that you would get it and you would succumb to it if you had a chronic condition.
Right.
If you were healthy and fit, you get COVID. You know, you'd walk it off or shake it off in days, maybe weeks. But those who were most affected had a chronic condition, and so again, to me, that seems to be a wake up call towards the chronic disease epidemic that we are facing in this country. Six,
Exactly.
6 in 10 adults have a chronic disease. 4 in 10 have multiple chronic diseases, and those numbers are going higher and higher because now chronic conditions affect younger children. You know, kids are obese now. It's no longer an adult issue. The number of kids with diabetes is extremely high. Um,
Exactly.
I mean,
Exactly.
you are looking at a massive toll in our healthcare system. Within the next, I believe by 2035, we're going to have a massive shortage of physicians. A massive, tens of thousands of doctors will be out of the system because many of them
Wow.
are retired.
Right.
So you are looking at, just within the next 10 years, a larger number of chronically ill patients and a significantly reduced healthcare population due to their aging as well, retirees and et cetera, and we're not replacing them fast enough. So you're going to have the perfect storm, and that's not even including the 30 plus million people that are uninsured, that are technically not utilizing the system to the extent that they should. Right. So you're going to have
Right.
the perfect storm of calamities caused by chronic conditions. So I think that having someone put the brakes to this epidemic by looking at the food, by looking at even the way we interact with people, does every disease require a medication? Maybe
Right.
for
Right.
temporary symptomatic effect, but there should be a case made for a holistic approach, looking at the diet, looking at the lifestyle, putting the onus on people, saying that, hey, listen, we're giving you, metformin for your blood sugar, okay? But I'm gonna tell you this: we're also giving you a coach. We're also going to give you
Right.
someone who's going to
Exactly.
put you through a
Exactly.
program. And hey, listen, if you fail to take advantage of this, that is on you. The state
Right.
bears no responsibility. You're young enough where you are, and you're competent enough to understand that these foods will spike your blood sugar. These foods are better for you, and the charge is on you, right? And so I
Right.
think that's where we ultimately have to find ourselves, where the government is actively encouraging, chronic disease prevention,
Prevention. Absolutely.
approaching chronic disease, incorporating those programs into their approach. Because I tell you this, I'm into there's something called chronic care management,
Mm.
which is an initiative by Medicare that they began back in 2015. Okay, and the initiative is they realized that that Medicare eligible population, 60,
Mm.
65 and older, they tend to have multiple chronic conditions.
Right.
And they tend to utilize the health system more because of their many conditions. So they're going to the hospital more than young people. They're going to the emergency rooms more than young people, etc. And this is costing Medicare as well as the healthcare system a lot of money. And so Medicare, in its wisdom, created this initiative called chronic care management. And what it is, it's out of office follow-ups with patients, so that, let's say, for example, I just recently started my own chronic care management company. So we'll have care managers that'll call you once a month, touch base with you, and follow up. Hey, Damon, how you doing? Is
Right.
everything okay? Do you have anything of concern? That way rather than waiting for something to go wrong and then you having to go to the hospital, we can actually intervene ahead of time. If you need us to set up an appointment for you, we will. If you need a pharmacist to review your medications, or maybe you have a concern, we'll get that for you. If 40% of people are not taking their medications as intended, right? So
Right.
that all sorts of things as well. So that initiative by Medicare, when they did the pilot program, they found that it did reduce hospitalization uses, it reduced visits to the emergency room, and the preventative visits to their doctors went up nearly 10%. And the creme de la creme, Medicare saved almost $1,000 per patient enrolled. So even though they're paying for this additional service, they're actually saving money. So
Saving money. Exactly.
so
Exactly.
again, it falls under that preventative value-based care initiative. And so I think that initiative should really be spread to everybody. Why wait until somebody is 65, right? Start it when they're 30 or 40 years old, right? That way you can get people used to the idea that, hey, I need to be an active participant in my healthcare instead of just going to my annual visits, my annual checkups, my annual, it's like when you go to your doctors and they say, hey, look, you have diabetes. You didn't get diabetes last night. Okay. It's
Exactly.
a process that happened over many years, right? Someone doesn't sneeze on you and you catch diabetes or high blood pressure. It is a lifelong process, and it just so happens that your body can no longer cope or suppress these symptoms. Now they're out there in the open, right? And so if we can intervene years beforehand, before these conditions happen, and we're saying, hey man, look, you haven't gone outside, you haven't walked a mile in a bit, right?
Right. Right. Right.
Water. If we can get people used to, again, it goes back to having someone hold your hand, coaching you, helping you out. We can make everybody a self-care advocate, conscious of their health, a willing a willing participant in their well-being. I think that's where we have to go, and I see uh, a great opportunity with RFK, because at least he aligns with some of these things we've just talked about.
Right, right, and for the record, everybody, we also understand this sister here, Angela also Brooks, the Democrat. Um, she's a Democrat. She also received. We're gonna go. Everybody that has these questions that's going after him. Right? He's like, brother's laughing. She received on Open Secrets. She received from health professionals $502,000 and 502 and 502.
Thank you for joining us on another episode of Wellness Wednesdays. If this information resonated with you, please hit that like button and share with someone who needs to hear this message. Subscribe to Black Westchester's channel for more content focused on our community's well-being. Remember, while Damon is certified in holistic health and wellness coaching, always consult with your healthcare provider before making any changes to your health regimen. Your journey matters, and we are here to support you every Wednesday. Until next time, stay blessed, stay informed, and let's make health and wellness the new black.